free until the end. Crib outside the city, I don't feel safe in my hands. Took so many years, I'm just waiting for the wins. I'm in debt to no one but the one who took my sins. I do it for real, there's no reason to pretend. If I do it once, I do it again. Add it up, bankroll, euro, peso, add it up, I'm just doing me, everything is on me, oh you matter what, add it up.
Man, what it do? This is your boy back again. There we go. Back again, this is your boy. North End Floyd, West African Floyd, Flizzle, Hizzle, all kind of names. If y'all, throughout the years, I got several names, so depending on what time era that you met me, that's what you're going to call me by. But I want to thank y'all again. I'm back with another show, another Friday. This is episode number 82. We getting close to 100, man. And also, it's been a little bit over 2 years doing the Kikback Podcast. So I appreciate everybody for sharing, comment, liking, so on and so on. What's up, Aubrey? Yeah, I'm all over the map. I got a lot of names. I ain't gonna lie. I got a lot of names. And they were given to me. They weren't made up names. So, this is a very important show because we're going through like some tough times health-wise. We got COVID out there. That's very important. We have a lot of other things that's important too. We got, we got screenings and stuff. We got health screenings that people tend to overlook and just don't care. They end up going to the hospital when it's almost too late, So I have a very important person who is an expert at such things. And, hopefully she can give you enough information that you can go down there and you can get screening or you can get tested and you can do such and such and you won't put a burden on your family. So that's what this show is about. Welcome to the show, ma'am. Miss Cordella, how you say it? How do you pronounce that name?
Right, Cordella.
Cordella, where are you from? You're not from Southeast Texas, not with that accent. I know people are going to ask that already.
I've been trying to pass it off as a Southeast Texan accent, but
I'm
not going anywhere with it.
No.
But thank you for inviting me on. It's a pleasure to be here with you. I am originally from Jamaica, and I moved to the United States over 30 years ago and lived in the Northeast until 11 years when I moved to Southeast Texas.
Oh, Jamaica. Okay, y'all. In the Olympics, how you feel about them in the Olympics this year?
It just started for us, track and field,
It don't start till track and field, huh?
That's right.
Yeah, I just had some Jamaican food for I want to say, I'm not the first time, but the second time in my life, a couple days ago. Jerk chicken and some pig feet.
Good. So you have a lot to look up for.
Yeah, it was good, man.
Yeah, and the jerk pork.
Yeah, the jerk pork. Yeah, that was good. So I was glad I met her and stuff like that. Because I always, as far as this area is kind of, as far as the food wise, it's not a diverse in it. So Jamaican, Caribbean food, I'm trying to see what that's about.
Me too. I want to see some more diversity with the cuisine, but it's getting there.
It's slowly getting there. So explain to the people who you are. People, tapping in and they say, "Oh, what's going on with this? What's this show about?"
Oh, so this show. My name is Cordella Lyon, and I'm a registered nurse. My focus at the moment is on HIV. And I do a lot of work around diversity and inclusion, public health, advocacy, and access to healthcare. So my role here today is just to share a little bit about what's going on in our community and how we can, be more cognizant of preventative screens, able to get tested, how to access healthcare, and so on.
I feel like with HIV, it's like a lot of people are embarrassed by it. They're embarrassed to even talk about it, to be honest with you. So as far as how do y'all, talk to the people? Because, I think for one, they might be embarrassed to even come with the problem or just, taking the test. So is it kind of hard to get that word out there, to get people tested?
It's getting easier. And HIV is celebrating 40 years in the United States. Can you believe it? It was in June that some young men in San Francisco, white gay men, showed up with symptoms that were then deemed to be HIV or AIDS, as they called it then. And we've been on the journey of shame and stigma for 40 years. Yeah. And I guess a lot of you know that, the images you saw were of people dying of HIV. You had to be gay to have HIV or something like that. So all of that has rolled into what we now see with people either having that internalized stigma of feeling that, well, they did something wrong, they are ashamed of their lifestyle, and they don't deserve to be loved or to access care, or that external stigma where people outside, maybe in healthcare facilities or wherever else they go, they feel that stigma is there. So yes, we validate that. But one of the big things is understanding that an individual cannot give themselves HIV. You had to get it from somewhere, right?
Yeah.
So there is, try to take away that sense of shame and letting them understand that, okay, you didn't give it to yourself. You didn't do this to yourself, and nobody deserves, to have HIV or to be living with HIV. And there is a cure. There's not a cure, there's treatment. And you can get into care and you can live a long, healthy life. Now, a lot of people think that Magic Johnson is taking, something special or that he's been cured. Mm-hmm. But I met Magic Johnson in Las Vegas a few years ago. Mm-hmm. And he told me that he's taking the same pills that other people are taking. The only difference is he takes his pills every day, he eats well, and he exercises. Okay?
That's it.
We have to bring that message to people. And the care has changed. It's no longer a cocktail of taking, 20 pills a day. They're now down to 1 pill a day. Pretty soon vaccines will be out where they can get one vaccine that will, not a vaccine, I'm sorry, a shot that they can get, an injection that will last them for probably 6 months, and then they can go back to the doctor, get another injection and manage their HIV. So, we've come a long way, but we still have more to go with the shame and stigma that the disease carries.
You think we're getting closer to a cure since, we're getting these shots every 6 months and you don't have to take that cocktail anymore? You think they're going to finally say, oh, we got a cure? You think?
I'd love that. I would love that. That would make me so excited. And I am hopeful because we've seen that we could have a COVID vaccine in a few months. But understanding the nature of the virus, then that's the scientific barrier. That's what's preventing us from having a cure, because of how the virus replicates. But I trust science, and I'm hopeful that one day we'll have a cure.
Isn't it a pill? I think I seen a commercial where the pill said if you take the pill, then it prevents your partner from catching HIV.
Oh yeah, that's the methodology is called PrEP. So it's pre-exposure prophylaxis, PrEP. And it's for people who are negative. So you're not currently living with HIV, and you can get on that pill. Works like birth control. You take it every day. It's 99% effective. So if your partner is, for example, your partner is living with HIV, you will not get HIV. And you take it for your season, that season of life. Say, for example, you're figuring, you know what, I'm just going to do me, or I'm not sure what kind of relationship I'm in at this moment, but this is what I need to protect myself at this time. Mm-hmm. Because you don't have to take it for life. Later on down the road, things have changed. You're in a monogamous relationship. You're both HIV negative. Then you can stop taking it. But PrEP is good for that season in your life when you may be at risk for exposure.
Yeah, now with HIV, you catch it through, because they was like, you can't catch it through kissing and saliva. It's only through blood, right?
It's through blood, and mostly through blood. We hardly have any vertical transmissions in the United States, and vertical transmissions is mother to baby transmission. And that's because the medications are so good now that moms who are living with HIV, if they're in care, then taking their medications, then they won't pass HIV on to their babies. Now, also, moms who are living with HIV, they are discouraged from breastfeeding because HIV can cross through breast milk. So they discourage them from breastfeeding. But so we find that through unprotected sex, semen, and so on, in blood and breast milk, one can transmit HIV.
Are the numbers going down, you think?
No.
No.
Sadly, no. And Texas is the first southern state to have a plan to end HIV. I'm really proud of us for putting that together. We did it back in 2018, I think. And we had a plan to end HIV by 2030. But we all know COVID came, right?
2030? Okay.
2030 to end new transmissions of HIV by 2030. It's a state plan, it's a federal plan, and it's an international plan to end HIV by 2030.
I would love to see that,
Me too. I would love to see it. But we know that COVID came, and COVID is still with us. It's a huge public health issue, and a lot of attention and resources have been shifted to COVID. Now, what's happening on the ground, even though, rightfully so, we're trying to put our arms around COVID, is that people are still having unprotected sex. People are still, doing what they have to do. So HIV is still out there. We're seeing more new cases of HIV, and we're trying to get, bring the focus back to prevention, in encouraging people to get tested, to get into care, to stay in care. But it's going to be an uphill task because so much of the focus has been shifted elsewhere.
I don't know if this is a HIPAA law or anything, but is there a website you can go to see the stats of Texas or Beaumont as far as like with HIV, and you know how they got COVID cases and they post it on the news every day? Is there? Oh, it is?
Yeah, the DSHS website. You can go to the DSHS website. You'll see your local stats, and because names are not listed. It's aggregate data. Mm-hmm. So it's just numbers, and it's broken down by county. And you could go in, you could look at your county, you could see what you're doing with HIV. Here in the Tri-County area, the most of the data is for Jefferson, Orange, and Hardin County. Mm-hmm. Because this is our health service area, health service district. And you'll see the number of people who are living with HIV, the number of people who are in care, and you'll see what our rate is. So for a lot of people, they get the data doesn't mean a lot to them. They're more concerned about, well, where can I get care? Because when they don't always see themselves in data. Now, for some people, they want to know exactly how many people are living with HIV. So
exactly.
We're trying to kind of walk the balance. And then there are others who will say, when you start talking data, they will say, but that's not here. So I try to make it personal, and to treat HIV as a chronic condition, and to allow people to understand that when they go in for physicals, your annual checkup, get your HIV screen. Your insurance will pay for it. CDC recommends it. I do it. I get tested on my birthday so that I don't forget. So I test every year.
Okay, this is like a birthday gift.
It's my birthday present for me to me.
Yeah, I feel you.
Yeah, because this way I know I got it done. So I try to make it personal. I try to let people understand that okay, forget about the big numbers, forget about where the numbers are. Just look at yourself and think about your personal responsibility to getting tested, to knowing your status, and to getting in care. Because that's where we meet people, when we're actually making it personal. Yeah. And another thing with HIV that I wanted to share is we talked about PrEP, but there's also PEP. And PEP is post-exposure prophylaxis, where if you were exposed to HIV, say, for example, somebody was sexually assaulted, or somebody, let's think about the sexual assault. You're sexually assaulted, you went and you saw the same nurse, or you went to the ER. What will happen is we will do an HIV screen and we will put you on PEP. That's medication for 28 days. You'll take the medication and you'll get tested again afterwards to make sure that if you were exposed, you didn't convert to HIV. Okay. But PEP has to be taken within 72 hours of exposure. So there is that time frame. And a lot of times people who are sexually assaulted, if they go through that shock and grief and all that before they come in for care, and the clock is ticking. So we have to get the medications on board within 72 hours of exposure.
Okay. Well, yeah. Well, I guess you're all right. I mean, they do have different medications to treat HIV. Mm-hmm. I never heard of a PEP or whatever.
PEP.
Is it a pill? Is it like a?
It's two pills. It's two medications. Two pills that you take for 28 days, and what it does, it protects your cells from the virus binding to it. So if you get exposed, then science is assuming that it's going to take you that 72 hours for the virus to bind to your cells, and that's why it's important that you get the medications on board before the virus gets to your cells.
Okay, I see.
Okay, so so time is very important, and I would like to take this opportunity to encourage anybody who suffered sexual assault, who feels that they may have been exposed to HIV, to seek care immediately. We can get you the medications at no cost, but it will only help you if we can treat you within 72 hours. Anytime outside of that, we can't guarantee that you're not going to seroconvert.
If somebody's sexual assault and they go to the hospital, do they automatically give them that?
Yes.
Oh, okay.
Yes. And it goes also for people, occupational exposure. For example, a nurse who got stuck with a needle, right, taking care of a patient, or a dental assistant or somebody like that. Yeah, if you get exposed, you can get your PEP on board, take it for 28 days, and then you go back and get your labs drawn, and go back again, and 6 months later. So we do that follow up with you.
Okay.
Yeah, but the time is important. 72 hours. That's your window. Yeah.
Another thing I want to talk to you about is mammograms, like breast cancer. Breast cancer is really serious as far as the NFL tries to do awareness to it, and you see a lot of As far as like cancer, I think like that's like the most popular one. Like the the country tries to get behind, with the pink ribbons and all that. When's the age that a female, even a male? I heard even males can have breast cancer too.
You can have breast cancer.
Yeah, that's true. But a lot of guys don't like to think. They think it's a female thing,
Right. Right.
But is it what, like 40, 45 or something like that? The age that you need to go get a checkup as far as like a mammogram or something like that?
Yes. American Cancer Society recommends that women who are 40 to 44 years old, you have a choice to say if you want to have your mammogram done at that time, 40 to 44 years old. From 45 to 54 years old, then it's an annual screen. And 55 and older, you get screened every 2 years.
Oh, okay. How is that process? Okay, so you being like a coordinator, do you see a lot of Black women coming in there, minorities coming in there to, get a mammogram, or is that something that our people tend to overlook until they have like symptoms like that are becoming like a main problem for them?
And yes, sadly, that is true. And one of the things that we look at, particularly in minority populations, we have to get over, the cultural issues we may have when it comes to accessing healthcare. For a lot of us, there's a distrust or a mistrust with healthcare. There is also affordability. If you're uninsured and you cannot afford, you just cannot pay for preventative screens and you don't know where to go, then that's a barrier also to care. And we do have a sense that sometimes we know what's going on, and I've even come across people who are insured, but they're not ready to own a particular diagnosis, so they won't get screened.
Yeah.
So it's validating what the individual is going through at that time, because we have to start where they are. If it's distrust, they may have had something personal that happened to them and it's causing them to distrust healthcare. And we start from there and work on through getting them into preventative screens. The Gift of Life is a wonderful organization. They do a lot of preventative screens for cancer, and they also do breast and prostate cancer screening.
Yeah.
And their number, I'm going to share their number with you so that those who need screenings can call, make an appointment, and go in and get their mammograms. And I know we're working real hard on continuing with our annual prostate cancer screening program. It's usually held every June. We didn't have one last year. We're hoping to have one in September, but we'll see what COVID does. And, we can get patients in for screening and ensuring that we can, it's with everything else, early detection is key. You know
what? You brought up prostate, and, guys with prostate, it's always that thing with guys like, oh, man, I'm not finna. Like, oh, you're going to get your prostate checked? And it's like, yeah, I don't know about that, And I heard somebody told me with prostate, they don't do it the old-fashioned way, like they stick something up your butt or whatever. I heard it was like, somebody said it's like maybe they draw blood or something. I don't even know. I forgot. I don't want to lie on that person.
That's correct. It's no longer a digital exam. Back in the day, it was a doctor doing a physical assessment of your prostate. And not only was that, that caused a problem for the patient, but it wasn't as scientific as the blood draw is, because, you do the blood draw, it's more scientific. So it's easier now. You do get that blood, you're just drawing blood,
Yeah.
So it's easier. And the Gift of Life, they do have the screens. We're hoping we can get it done this year, where we'll have men come in and we draw their labs and we include all the other glucose and cholesterol, HIV, Hep C, and syphilis screens. So maybe we can get it done. Let's see what happens. But for men, it's recommended that they start screening at age 50.
Oh, really? I thought it was like 40.
So
I would have went in there early.
You
Doctor, like, you a little early.
It's recommended they start screening at 50. So, and of course, then colon cancer also. That's the colonoscopy, the dreaded colonoscopy.
Yeah.
Start screening at 50. And, we do, I did mine. I turned 50 last year and I didn't get a chance to do my colonoscopy, but I was there first thing, in 2021 because it's preventative screening. That's it. That's the best thing to do.
You don't even look that age. I'm not even gonna lie.
Well, thank you.
You're looking real 37-ish.
Keep your glasses on.
You're looking real 37-ish right now.
Thank you. But the preventative screen, getting your shingles shot, that's another one. Get your preventative stuff on board because the prevention is cheaper than treatment. That's the key. Most insurance companies, they pay for preventative screens. So go ahead, take advantage of it. I like to encourage people. We're approaching September when we'll have open enrollment for the ACA, the Affordable Care Act. Go ahead, get enrolled. I mean, why sit down and say, poor me, I can't afford, I don't have insurance, and so on and so forth. Try, enroll, get your preventative screens done because it's cheaper than treatment. Always cheaper than treatment.
Yeah. And you said 50. So if somebody 40, if they want to just go, I mean, is that still a great idea, or is 50 the age that, it might show up or something? I don't know.
No, it is, because for many, particularly Blacks, we find that there may be a history. If you've had a history of colon cancer in your family, if you've had a history of prostate cancer, you have a valid reason to get screened early, or a history of breast cancer. You have a valid reason to get screened early, but it's having the conversation with your provider. That's the deal. You go in for your assessment and they give you 3 pages of checkoffs. Do you have hypertension, diabetes? And sometimes it gets boring, but make sure, after you've done that checkoff, you talk to your provider. Hey, my grandma died of prostate cancer, of colon cancer. I am 40 years old. Do you think I should get screened? That is extremely important, and we sometimes do the checkoff, hand it over to the receptionist, and we never revisit it. But speak up, by all means, do.
Yeah, Mitch just reiterated what you said as far as like if you have family history, and I think a lot of people like they underestimate that, like as far as the family history, like if your grandma had something and your great grandma or your aunt, it's like red flags, and maybe you need to go ahead and do that preventative, check. I think, I think, this is inspiring me to go do some preventative screening as far as like prostate and colon, because you don't have to do that dreaded, bend over and cough thing.
No, you don't have to cough twice. It's a blood draw. It's called a PSA. It's sent off to the lab, and you get your results back, and you take it from there.
I got a funny story. I was going to work at this particular company in Corpus, and I had to go do a physical, and I was talking to this officer down here, and we was joking. He was like, "Yeah, he's gonna have to do that. You're gonna have to take your pants off and cough twice." And he was saying how he said how he did it and his butt was wet. And so when I drove to Corpus, I was thinking about exactly what it said. And then I did the physical, and then the doctor, he's like, drop your pants. So I dropped my pants and I turned to the side a little bit, and he was like, no, what? He said, no, face me. And I was just thinking about what the officer said, and then I was like, oh my God, that's embarrassing. I just turned around for nothing. And then, and I was like, I never told nobody that story till today.
Were you disappointed?
No, I wasn't relieved. I texted him and told him what happened. He just laughed. He's like, he's like, I was joking. I didn't think you was. I was like, yeah, man, I was thinking about that all night when you told me that. So, as far as getting your colon and your prostate, check, guys, y'all don't have to go through that dreaded cough twice and bend over and stuff like that.
Bend over, no. And the colonoscopy, you take your prep, you go in. I tell everybody it's the best sleep you'll ever get. You're out. You don't know what's going on, and you wake up, you get your results, and you're good to, you're good to go. But prevention, that's the key. It is. It's so much better, and then you have peace of mind. Either way, you're going to know you're okay at this time, or you're going to know, well, I caught it and I can do something about it. Because when without prevention, and then somebody shows up, and I say this to people all the time, you suddenly you show up, you're in the ER, then you hear you have to be admitted, right? And then it goes from one test to the next, to the next, to the next, because now the doctor's finding out all these things that you've ignored over time. But then family members show up and say, oh, he was fine. And then he went to the hospital, and then suddenly all of this is wrong with him. No, he wasn't fine. He wasn't fine. And this is not suddenly. These symptoms, they've been there for a while, but they were ignored. And you can only tell through testing. It's not how you look. It's not, anything else like that. It is through testing. So, I encourage people, I encourage individuals, speak openly, speak truthfully to your providers, and get your preventative screens on board. Get your vaccinations. Do what you can, because you are the ultimate driver of your ship. So do what you can to keep yourself safe and healthy.
Is it important to have your own doctor, or it doesn't matter as long as you just go get, your screening? Or is it, and what I'm saying is it more important to have like that one-on-one relationship with just a doctor so they can be more familiar with you, or, is it just okay as long as you just go down there and get screened? Because I know, like, all the time, when if I go to the hospital or something, if I'm sick or whatever, and they're like, do you have a doctor? And I'm like, no. And I'm thinking like, man, maybe I should have like a doctor, that I just, if something happens, I could just, go to him and he'll have like a more of a rapport with me as far as symptoms and stuff like that.
I encourage people to have a relationship with their provider. And I'm also realistic in understanding that not many people do. However, when you have, or anyone has the opportunity to interact with a provider on a patient-provider basis, be open and frank with that person. They're there to help you. They're going to use their academic training to help you as best as possible. And they can only do so if you tell them what's going on. Give them as good a clinical history as you can. And they will do their best to help you. Because I'm being realistic. We live in Southeast Texas. This is the I-10 corridor. We have migrant workers. We have seafarers. We have, people who are just passing through. We have people who are uninsured. I can't tell everybody that you must have a provider and have a patient-provider relationship with that person. But I can say when you meet with a provider on a patient-provider basis, make sure you're open and frank. Build that relationship, because that's the best way to ensure you're going to get, good care. Because they're not, they don't have crystal balls. They can only go by what you tell them.
Yeah, they're not. Yeah, like you said, they're not psychic. You know what I'm saying?
They're not. They're humans.
Yeah. Yeah, exactly. So I talked to a coworker of mine, and he said as far as checkups, he goes twice a year. You know, even if it's nothing wrong with him, he just goes down there just to get checked up and talk to his doctor about things and stuff like that. And I was like, oh, that's kind of dope, you know, because I didn't know too many people that do that. They only go to the doctor if something's happening and something's wrong with them. But he goes just, you know, regular routine just to talk about, you know, stuff that's going on and stuff. And I thought that was kind of neat.
That's good. That's good. And think about it. You're paying for your insurance anyways.
Yeah, yeah.
Your preventative screens are cared for, or you know, they're paid for. I mean, if you go in, and one of the big issues too is as he's going in and he's checking in with his provider, there are issues like mental health. You know, that if it is something like, you know, it's, you know, doctor, I'm not sleeping well, I'm concerned about this or that, you know, my eating habits have changed. Maybe you probably need to check in with a therapist or a psychiatrist or somebody for a little bit. And that is fine too. That is fine too. But if we're not having those conversations, then we don't know those opportunities exist. I mean, a friend of mine told me that she was surprised to find out that her insurance paid for chiropractic services, and she'd been having horrible back pains. You know, but just think, you know, she didn't know until she couldn't bear it anymore, and she was going to pay out of pocket for their services when the chiropractor said, what insurance do you have? So, you know, there's so many ways that we can actually, you know, take care of ourselves, but sometimes we get caught up with life and we don't.
I'm not gonna go lie to you. Like, as far as like symptoms, like I think I got bad knees. Like my knees, like I be at work and, you know, being an operator, we're sitting in front of a screen for a while. Okay. And sometimes I have to get up and just walk around and just, I don't know. It's like my knees. It's hard to explain, but it's even when I'm sleeping. Like if I'm sleeping and I wake up and it's like, I don't know. It feels like my knees it's like they need to be stretched, like they're stiff or something. I need to go talk to my doc about that. I don't know. Maybe it's like arthritis or something.
You need to go on in.
Some bad cartilage or something. I don't know.
Go on in. You never know.
I need to get a doctor. I need to find me a doctor. Do you have any doctors? Well, I'm not going to say that, but maybe off the air. Maybe you can like
we'll talk off the air. We'll talk off the air, but we have some very good doctors in Southeast Texas. Let me say that. I've worked with some very good doctors in Southeast Texas. They're passionate about what they do, and what I love about them is they're always finding creative ways to meet their patients.
Okay.
I absolutely love it because they're not just sitting in their offices and you know, waiting for patients to come in. They're finding creative ways to meet their patients' needs. So yeah, we're truly blessed down here.
I would like to meet those doctors too and get those. I mean, and see if I can.
I'll hook you up.
Yeah, see if I can introduce them to like a lot of people as far as like, on my Facebook, because like you said, like I'm saying, a lot of us don't have our own personal doctor. If we're sick or something happens, we just go to the hospital, minor care or whatever, instead of, you know, booking an appointment and go and talk to our doctor. Well, we might have a more close personal relationship with.
Right. And really, that's not what the emergency room is for, you know, to just run in when something is wrong with you. And usually you're going in after work, late at night or something like that, because you don't have an established provider. But what I also find is that we've missed that transition where children who age out of pediatric care, where your parents took you to the doctor, and you know, so you always went in for your physicals and you waited for mom to make the appointment and she dragged you in every year. Okay, so now you're older, you've gone off to college and you got a job and you have health insurance. You have that health insurance, right? But you're afraid to make an appointment with a doctor because you don't even know who this new person is. It's no longer your pediatrician. You're on your own as an adult, right? So we find that there's that gap because, you know, our kids, our young adults don't know how to make that transition into family practice or primary care because, you know, they were used to mom making that appointment and now they really don't know how to start.
Yeah, that's true.
Yeah,
that's exactly right. We are used to our moms making that appointment for us. So when we try to transition out, We don't really know the steps to take as far as the, to make that appointment, or even like you said, find a doctor. Just finding a doctor, you really got to kind of research, because you don't, like you said, some passionate doctors and stuff like that. And just the average person, we're trying to find out who that passionate doctor is, and it's kind of hard, as far as like researching and like just typing in names and all that type of stuff. So, I agree with you personally as far as like transitioning, because that's something I never thought about that too. That's very.
Yeah, that's big time adulting right there. And or some of our young adults, they can't handle it, and so they wait until they'll treat their symptoms, and then when it gets really bad, they show up to the emergency room. That's not healthcare. That's not healthcare. So my dream would be to see where we have some kind of transition for our young adults, as they leave high school, and getting them ready to make those appointments. And it's not just with going to the doctor, it's going to the dentist, because if it doesn't hurt, you're not going to go.
Yeah.
You're going to pretty much, say, oh, well, my mom has to make this appointment.
Yeah. My mom, shout out to my mom, because she still tries to do stuff for us and stuff. And, I appreciate mom. We just recently had a conversation, like the family, about life insurance.
Mm-hmm.
And she, and it was a pretty dope conversation. It was funny. We didn't take it serious at first. She got a little mad, but then, it was a nice conversation about life insurance. That's very important too. Hey, y'all get y'all life insurance. If y'all want to know some people to get in contact with life insurance, I got y'all. Just hit me.
That's right. Healthcare proxies. Who will make your decisions if you're not able to?
Mm-hmm. Yeah,
that's important.
And like you said, with mental health, I do have a mental health show in a couple weeks too. We're going to talk about mental health also.
Good deal.
That's very important. The main thing, that's going on right now, COVID. You said COVID has got a lot of attention as far as like with the doctors and medical staff. How busy are hospitals now with COVID? I know y'all was busy before COVID, but like since COVID hit, like how? Because I haven't been in the hospital since COVID hit. So I mean, like when you're in minor care or whatever, how are they separating people due to like if they got COVID or not? And because usually you just go in there and sit down and just chill until they call your name and stuff. So.
Well, color yourself lucky that you haven't been to the hospital since this new surge. So good for you. Try to stay away. But if you need to go, by all means do. Okay.
Uh-huh.
And this is what I admire about hospitals. They're experts. They're experts in managing and containing disease. Okay. So they are clean. The staff is efficient. They clean, the housekeeping staff, nurses, phlebotomists, x-ray techs, physicians. They know what they're doing when it comes to containing diseases, okay?
Mm-hmm.
Infectious diseases, they know. So number one, I would like the community to know if you're experiencing signs of symptoms of heart disease, anything that's going on with you, if you are sick, do not stay home. Go to the hospital, okay? Mm-hmm. We don't want anybody dying from a heart attack because they fear that they may, something may go wrong by going in. We are inundated with patients. We are full. And we're seeing younger patients because most elderly had already gotten vaccinated. So we're seeing younger patients. What my personal concern is that the young people who are in the hospital now, they are our members of our workforce. They are also people of childbearing age. And that's going to have a serious impact on us because if they are sick, who will be at work? And if they are sick, who's caring for the kids? And will our kids be ready to go back to school? So that's my personal concern, okay? But yes, we are inundated. We are doing our best, providing excellent care. I mean, as tough as it is, our nurses are out there providing care. And I see you have the vaccines that are available. The Pfizer, it's 2 doses, 3 to 6 weeks apart. Moderna, it's 2 doses, 4 to 6 weeks apart. They are mRNA vaccines. And for those of us who've been waiting for the Johnson & Johnson, which is the one and done, it is available also. And if you can, please get vaccinated. You will be able to not just prevent yourself from getting the severe impact of this Delta virus, but you could actually save somebody's life.
Yeah, I see that the Johnson and Johnson, like it's 1 dose, but I see more people getting like the Pfizer. Am I saying that right?
Yes.
Yeah, I had a friend who just took the Pfizer a couple days ago. He said everything's okay. He says his hands, I mean his shoulder is just sore.
Yeah, it's like getting the flu vaccine. That's how I felt. A little soreness, and it goes away after a few days. And everybody will have a different reaction. So I will not invalidate anybody's reaction to a vaccine. But I'm saying if you can, please take the vaccine. It is available throughout the community. The big box grocery pharmacies do have it. Walmart, Walgreens, and CVS do have the vaccines. I know down in Port Arthur, they have all 3 on hand, and no appointment is needed. They're open Monday to Friday from 8:30 to 4, and they will vaccinate your children 12 and older on any of those days as well. Those children, Pfizer is recommended for those who are 12 to 15 years old.
How do you what's your answer to people that are scared to get the shot? They're talking about like the government and all these theories and stuff. And what do you think about people saying that? I'm not getting that shot. Not the government.
I first listened to why they're not getting the shot. I mean, this country has had a history where the Tuskegee study, the men who were infected with syphilis, they were in that trial, and we know that went south. And for a lot of Black people, they have a distrust of healthcare. And for others, it's from what they've heard, either online or from friends and so on. But it's finding out what it is. Every individual is a different story, and taking it from there with a positive spin. Because I know I've taken the vaccine. I know what my experience has been with taking the vaccine. So we have to treat, it cannot be just across the board, this being dismissive of individuals. I think we have to be one-on-one and answering questions directly as healthcare providers, because when we validate people's concern, then we can meet them where they are. And then we'll have an opportunity to change their minds, or to teach them or show them, why this vaccine is good for them. And one of the issues I have too is, as we look at hospitals and how full they are, is knowing that even if I do not want to take that vaccine, the hospitals are full. So if there's a big accident on I-10, my loved one may not be able to get care at the hospital. If my loved one has a heart attack at home and the local hospital is full, where will they get care? So it's not just about me not wanting to take the COVID vaccine. It's about so many other things, in the community. But the hesitancy is there. We have to meet people where they are. We have to sit and talk with people, share our stories, listen to their experiences, and move on from there. I don't think we should go blanket across the board and be dismissive, but it has to be a conversation that we have as healthcare providers.
With COVID, you said they have to be 12 and older. You think they're getting to where they have a shot that's going to be younger than 12 years old?
Yes. Pfizer is seeking the emergency use authorization for individuals who are 5 and older. And I think coming up in the very near, maybe in the next 2 or so weeks, we will hear more about that. But at the moment, the Pfizer vaccine is the only one that's authorized for individuals who are 12 to 15 years old.
So you're saying before this year over with, they'll have it for like 5 and older?
I believe so.
Okay. I think they might have it where, your child's going to have that shot before they go to school. I'm not saying now because school is going to start, but I'm just saying.
Yeah. You never know. You never know.
Like
but
they have.
I know that that's coming, that Pfizer, they're seeking it's called the Emergency Use Authorization, EUA. And that's what's being used for adults.
Mm-hmm.
And it's being used for children 12 to 15 years old.
I don't know if you know this. This is more of an insurance question. How many times can you get checked for COVID? Like, let's just say somebody's like real concerned and they get, they got COVID tested in February and then they got it in June. How many times were they let? Because I remember them saying, like, as far as COVID testing, it was only so many that they had at one particular time, to get checked up. So, how many times you think a person can go get? Because I got COVID tested earlier this year. A friend of mine, she ended up having COVID, and I hugged her. And when I seen her and stuff like that, and then the next day they said, she had COVID. And I'm like, oh my God. And then I was like at work, and I was like, oh, my throat feels scratchy. And I was like, oh, I'm getting a headache. So I went immediately and got tested. And so I'm thinking, like, since I got tested, can I get tested again just in case? I don't know if they're limited with the testing, and they'll be like, oh, you already got tested this year. I'm sorry.
No. So you can get tested again. I would recommend that if someone, for example, you hugged somebody and just in your case where you heard that the person had COVID, going off the test the very next day, I don't think it's a wise idea. You wait, I think it's about 5 days or so before you would have a true positive, right? So if you were to go immediately after hugging the person, you may test negative, but that's because you're not yet symptomatic, okay? So you'd have to wait for a few days before getting tested. Getting tested in February and testing again, if you've been exposed and you're experiencing symptoms, please get tested. Yeah, don't sit and say that you won't get tested again. And then what I do know also is that there are some employers throughout the country, who are saying if their employees will not get vaccinated, they'll have to test every week.
They got to test every week.
If their employees will not get vaccinated, they will be required to do weekly COVID testing.
Man, I wish our job did that.
So that's, if you tested in February, you can test again. And as long as you are symptomatic, yes, go ahead and get tested.
So I'm looking at that Pfizer. So you get the first dose and then you get the second dose either 3 to 6 weeks later.
Mm-hmm. Yes.
And they schedule all that too, so you won't miss, you won't accidentally show up 8 weeks later. Right.
They do schedule you when you when you receive the first dose.
I know everybody's different, but they said like that second shot gets you, like that's the one that kind of gets you a little weak or sick or something like that.
You're right. Everybody's different. I didn't have any of those symptoms when I got my shots, and I finished my my second dose by the end of January. So I took my shot early. I didn't have any of those symptoms, but what I would recommend is that, because some people know offhand that even for a flu shot, they will get soreness or temperature. You could take your Tylenol, before or after you've received your shot so that you can minimize the symptoms. I registered with CDC also, and I felt really special because they text to check on me, the day that I received my shot, and they text me a week later and 2 weeks later, and up until last week, they were still following up with me to the last question they asked if I got pregnant since I received my shot. So they do check in on you. So you know, and if you know your body, if you know something is just not right, seek care.
Yep. Yeah, don't be quiet. We had a guy that just recently tested positive at our job.
Wow.
I don't know if they want everybody to get tested or not, but I'm thinking maybe I should go get tested, to be honest with you.
Yeah, you can go. I think, is it CVS that does the drive-through testing?
I think so. When I got tested, I went to King's Pharmacy on Major Drive.
Major. Mm-hmm.
Yeah, and a lot of people that we used to see those tests where they stuck it all the way up your nose, and I got that done, and it's not that bad. It's not bad at all.
Yeah.
So for the people that haven't been tested, it's not bad. I'm not even gonna lie to you.
No, it's not that bad. I got tested the day before my colonoscopy because that's a requirement for any procedures. And I was dreading. I thought they were going to actually go all the way up to my eyeballs, as some people said, but it wasn't. It wasn't that bad. It wasn't that bad.
They're gonna puncture your brain because so like you hear all kind of rumors and saying and stories and stuff like that. But, Terry said a lot of healthcare places test frequently. I guess
Yes, they do. Yes, they do. And this is the key with testing also. If someone tests and they are positive, please go home and isolate. Please do not go to Walmart, H-E-B, or any place else to pick up groceries before you go home. If you are positive, you need to be at home isolating. Okay? It's not something like, let me get these groceries before I go home. No. Go straight home and isolate. Right? Because we do have people, I had a lady, she called me up last year when she says, "Oh, Miss Cordella, I just wanted to know that I got tested and I have COVID, but I'm going to run into Walmart and pick up some groceries before I go home." I said, "No, you're not."
She want to be comfortable when she.
No, you're not. You're going straight home and you're going to order those groceries online. Yes. And you're going to have somebody go pick them up.
Yeah. Okay. So I said a coworker tested for COVID. So since he tested for COVID, and let's see, I think that was Tuesday or Wednesday. So do I need to wait till Monday to get tested?
Yeah, that would be a good time to go get tested. Yeah.
Like next week?
it would be a good time to go get tested.
Okay.
My daughter thought she was exposed to COVID. She's 20-something years old, these young adults. And she isolated herself in her bedroom. She was wearing a mask around the house. And she was, trying real hard to get tested. I said, "No, baby girl, it's too early. You have to wait." Yeah. But it would be a good time to go get tested.
Terry said if it's best to get the antibody test.
For COVID?
Yeah.
And because that will tell if you've been exposed. God bless you.
Thank you.
That will tell if you've been exposed to COVID. And that depends. I mean, some people are wanting that to see if they were ever exposed. I don't know if it will show an active infection. I don't know. But but for some people, they're really wanting to know, so they get that antibody test.
So I talked to you before. What all do you have going as far as like, as far as like medical health things? I know you got a few things that you're working on.
I know. I got a bag of goodies here. Okay. So first thing, my passion, right? If anybody's out there who's living with HIV or Hep C and you'd like to get into care, please call me. My voicemail is secure. Leave me your number and your name, and I'll call you back. I promise. It's a secure voicemail. Nobody else answers it but me. My number is 409-212-7525. Or if you want to get tested for HIV or Hep C, call me. Okay? I don't want to. Pardon?
What's the number again?
409-212-7525. If you're living with HIV or Hep C and you want to get into care, I'll take care of you. If you want to get tested, call me as well. Okay? A secure voicemail, leave me your name and number, and I'll get back to you. So that's number one. Number two, the Gift of Life, wonderful organization that helps with cancer prevention screening. They are hosting a series on living with cancer. And it's a fun group that is being led by Miss Ingrid Holmes. And she has another facilitator. It's called Active Living After Cancer. It's a 12-week virtual program, so you do not have to leave home, right? And the classes started on July 15th. They run from 2 to 4 p.m. And this is the number to call to join. Okay, Active Living After Cancer. The number is 409-833-3663.
I didn't post it for those people out there.
Yes, please post it. And that's also the number to call if you need to enroll for mammograms or for the upcoming prostate cancer screening. 409-833-3663. This Active Living After Cancer is a fantastic group. It teaches about diet, about exercise, about coping, finding yourself, enjoying your journey. It is wonderful, and it's virtual, so you don't have to leave home. You don't have to worry about COVID, exposure, transportation, any of that stuff. You could always go. And of course, we're looking forward to having, hopefully, if the surge subsides, we will be able to have the annual prostate cancer screening event, which will be on September 11th and 18th. I'll keep you posted on that because we're in a holding pattern right now. We don't quite know what's going to happen.
Due to COVID?
Yes, because a lot of our volunteers are healthcare professionals. We have all the nurses come out to help with blood draws and vitals, and the doctors are usually on site to go over any abnormalities. And there are also the FQHCs where we link people directly to care. So, that's the core team that is on the front line right now. Yeah.
Is it another way to see this information? Do they have like a page or something like that we can share, or can you post the information? Is there a way you can post the information on my page and I can share it?
Sure. I'll post the information.
Terry, not to cut you off, Terry did something. He said something earlier, Terry Roy. Shout out to Terry Roy. He said something as far as like if a guy goes to get a prostate test or screening, or I think it was colon screening, he was like, give him a free shirt. Because I have my own shirt. I have Kikback clothing. So you know what? I'm thinking about doing that. If y'all go get, I'm not going to do like 100 people. I can't afford that. But I'm going to do something where I go get like my prostate colon checked and stuff like that. And whoever wants to go, I'll give them a free shirt to go or whatever. So.
Oh, that how will you know who goes? They'll have to somehow. Well, you'll work that out.
Yeah, I have to work out the detail. He said 10 shirts. God damn.
But you know what? At the Gift of Life, we screen approximately 800 men per year. And we have prizes. So there's always, you could donate to the gift, the prizes, they receive lunches, and so on. It's always a fantastic opportunity. It seems like we're meeting old friends every year because the men, they keep coming through year after year, and we catch up and they get their screens. So yeah, people like, being recognized. They like being acknowledged for doing good deeds. So yeah, give them the shirts.
Yeah, I'm gonna have to do that.
Terry gets a shirt too. That's his name, Pete Terry. He gets a shirt too for making this suggestion.
Yeah, he's gonna have to do a shirt too. The shirt's kind of expensive, so but he no doubt he go get a shirt just for doing that. But I'm gonna have to get mine first. I gotta lead with example, so I gotta get mine first, and then after I get mine, then I can tell people about the experience, and I can hopefully motivate them to go get theirs through the through the foundation, the company that you just said. So
that's right, and that's why I get my HIV screen every year, because I have to lead by example. And because when somebody says, "So did you get screened?" I can truthfully say, "Yes, I did." And I can truthfully tell them how nervous I was the first time I got screened, because I didn't know what the result was going to be and how I was going to take it. So, yeah.
Okay. Terry said you're going in a few weeks. Okay.
Yes, Terry. Congratulations.
Yeah. This show right here just motivated me to think about my health. Because, like I said, what I did with my daughter, I want to continue living a healthy lifestyle for my daughter. I want to see her get older and stuff like that. And it's the responsibility of me to, do those certain things, like the get screenings and stuff like that. So very important, I know I told you 30 to 40 minutes. It's been an hour.
I enjoyed chatting with you. I hope we were able to share some good information out there with the community. I gave you my number. They can always call me. We do a lot of advocacy. I mean, this was the year our legislative session just ended, where we advocated for, the big wins were House Bill 4 and 5 in getting internet broadband access, for communities, so that people can actually log on for their medical care and work and so on. So yeah, all that goes on. Nurses are not just sitting at the bedside anymore. We're doing so much more. And it's great to be a part of this awesome community. So thank you so much for having me on.
I know you're very busy, but something like this, and with COVID and they got variants going on and stuff like that, I would love to have you in a couple more months to do a checkup and it's for us to see what's going on out there, and the hospitals, and to continue the importance of getting screening and getting our COVID shot, and debunk the theories that's out there on the COVID shot. Because I haven't got my shot yet. I'm not even gonna lie to you. I haven't got the shot yet. I've been scared. I've been nervous.
I'll go with you. I'll meet you at Walgreens tomorrow morning. And I'll hold your hand while you're getting the shot.
It's not that. I don't know. Because people are getting the shot more and more, and as far as a lot of these theories are getting debunked, and I don't like to listen to other people, especially the ones who haven't got shot. But I was gonna get the shot, but I was gonna wait, till next year after, and see how everybody's doing and all that. But now, since they're coming out with variants and different strains of COVID, I think that it's more important now to get it, because like you said, the hospitals are filled. So if your loved one gets into a wreck and they have to go to the hospital is full of people that didn't get the shot, and they're in there for COVID because they didn't want to listen, and they waited. So
that's right. That's right. Our workforce is in the hospital. Who's going to be at HEB when we show up tomorrow morning? This is the reality. And our kids are going back to school. So for the little ones who cannot get the shot, we need to get it for them. But as I said, I am willing to sit with anybody, because I want to hear from them why they're hesitant. I want to be able to validate their concerns before I force anything on them. It's no longer talking at people. It's about having conversations and having individuals feel like you're listening and you care, because we've done 18 months of talking at people, and we kind of need to step back and realize that it's not just about us in, A, you're getting the shot, or B, you're not getting the shot. It's about having conversations as people, as a community, and making sure that we are being respectful of each other and we're looking out for each other.
Exactly.
Yeah.
I want to thank you for coming on the show. Also, I need a list of those couple doctors that you said that was passionate. I want to have my own doctor. I want to be like, do you have a doctor? Yeah, I got a doctor. Dr. such and such.
I know all the good ones.
So
and I only know good doctors.
I definitely want to get with you on that. I want my own doctor, especially like a family doctor. So
yeah.
But I do appreciate you taking your time out and coming on this show, because I know you've been very busy.
I appreciate you having me on. And I'm here for the community. I'm here for you out there in listener land. Remember, my number is 409-212-7525. Call me. I'm more than willing to, go through the issues with you and get you into care, get you that which you need.
Yep. And like I said, once again, I appreciate you coming on. I just posted a number for people if y'all want to hit up.
Thank you.
And just leave a voicemail. And like I said, like she said, nobody's going to listen to it but her. So, you'll be all good in that point. But I thank you for coming on. And I hope you have a great weekend. And like I said, I'm going to inbox you about a couple of things.
Yeah. We'll talk. Yeah, definitely. I appreciate it.
So you enjoy your night.
Thank you. Bye-bye.
Thank you as well. All right, y'all, man. I don't know why I got the sniffles. This wine got me sniffling, man. I don't know if this wine got me sniffling or finding out that one of our coworkers had COVID or whatever. So, hey, my boy Adrian tripping. Hey, man, I appreciate y'all tapping into this show. This was a very informative show about COVID, about HIV, about breast cancer, colon cancer, prostate cancer. Really the screenings and stuff like that. So, you know what I'm saying? I hope y'all paid attention. If you want to talk to her and discuss with her privately, she listed her number right there. 212. Damn, I can't see. What's that? 7525. 212-7525, man. If y'all call her, y'all got any questions, just leave a voicemail. She will answer it. If y'all nervous about anything, or if y'all are skeptical of taking the COVID shot, like myself, you can talk to her and she'll explain some things to you. So, man, I appreciate y'all tapping into the show, man. I'm finna get out of here, man. I'm finna continue sipping some of this great wine and stuff. This is some good wine. And I don't know, I got sniffles and stuff like that. So, but I thank y'all, man. Y'all have a great weekend. Y'all turn up. Y'all be safe. I think I'm going to do a show next week. I wasn't. But I'm going to do a show next week. It's going to be like about music. It's going to be another music, hip-hop, R&B, soul music, jazz, such and such, this and that. And I think I'm going to hit up a couple of artists from Beaumont. My boy Trap Baby. My boy Deuce. And another couple artists. So I think I'm gonna bring them on. We go talk. We go chop it up about some music and all that type of stuff. And then after that, I got a mental health show coming up. So y'all tap into that. You know what I'm saying? So I'm finna get out of here, man. Like I said, man, y'all be safe. I said HIP. Y'all be safe. Y'all have a good weekend, man. I'm finna get out of here, man. So I got some stuff to do. Got some wine to sip. And like I said, y'all take care. Thank y'all for tuning in. I'm out. I holla.